Hello and welcome. We're coming to you live from the kitchen table.
Hey, what's up, y'all? Just giving you a little update on how I'm doing, and I'm doing pretty good. It's been a few weeks, and you've been watching my journey, and I hope I help some brothers out there and with the journey they're going through, and they about to. So I have received some emails, and I received some phone calls and texts. So I hope I've been helpful for the information I have shared with you, and I hope my experience is helping everyone out still with this process. So yeah, that's it, right?
Okay, so let's keep going because I know it's been a little bit. So how are you feeling now? It's been, 5 weeks since your 5 weeks exactly since your surgery. And yeah, how do you feel?
I feel good. Right now it's like, able to walk further, able to drive, so I feel good right now. Like getting a lot of positive energy and love and stuff like that. So able to sleep a little better, move a little better, it's a little sore on the sides and stuff like that, and still making some adjustments from the bladder reconstruction, and also with the prostate being removed. It's still some kind of, when you have to go do number 2, it's still a little adjustments there, but it's okay. It's going okay.
And I've been noticing that you have been sleeping a lot more. And did you think that you would be sleeping like as much as you are? Like you realize you do something and you still are kind of tired.
Yeah. Now, the energy levels is not as up like I used to be. Like I'm not gonna lie with that. No surprises, my body's been through a lot. The whole anesthesia stuff still taking on. Like I said before, restructuring, inside with the bladder and the prostate being removed. You got incisions and stuff like that. So it's a little different. You can't lift weights and stuff like that. So my energy level is a little bit down, but eating normal, stuff like that. Not trying to stay away best I can from the processed stuff and stuff like that. Yeah, so still got my sweet tooth once in a while for some cookies.
That's never going to go away. Yeah. So what do you think so far, before we go into some of the good stuff that's been going on, what do you think so far has been like the hardest part, even still up until this point?
I would say it's still urinating a little bit, because you still have the sting in your penis a little bit in the head, and so it's been a little challenging there sometimes. Also challenging is laughing, coughing, moving sudden movements. You still have a little leakage when your urine comes out sometimes. So sometimes my silly friends, they make jokes and I laugh and I pee. And the wife also makes silly jokes and does stupid things and try to dance in front of me. So, and I little tinkle winkle. And you ladies can tell me that y'all be tinkle too. So I'm down with the ladies now. I understand when y'all say, "Oh, I had a little tinkle."
Okay. So yes, so it's just been an adjustment for you, right? Yeah. And but I think one of the things that you've been grateful that you can be home and just recovering and relaxing and really getting to take this time for yourself.
Yeah, it's like, you have to take time for yourself now because you only get one you. So when they say rest and the doctors at experience, they're saying you're going to take these many weeks, take that many weeks. Work will be there. But it's just time now to make you think about family and yourself. So that's what I'm doing.
Yeah. So let's get real. Let's get honest conversation, right? Because you say you're always going to be honest. You're going to be candid. You're going to be 100% truthful. Y'all, I want to let you know we have a graduate in the house. I'm about to get him a diploma and a cap because he has graduated.
See, trying to make me pee right now. See? Trying to make me tinkle.
You have graduated to...
I'll show you.
The next stage?
The next stage. So...
Show where you started.
Well, I started from the bottom, now we're here. So these have been my underwear and Depends. They've been keeping me nice and dry. I out the powder, so this has been my protection, so I don't tinkle on myself. So these are, I graduate from these things. They're nice, but they keep you a little hot down there. So I graduate from these to, ready?
Drum roll, please.
Man pads. Basically, men sanitary napkins. So these are my new little friend. My wife had to show me how to put these on, and I really appreciate it. Yeah, I'm just saying, you know. And
you see, it has a thing men right on the
men. To make sure you don't mix it up with women ones, you got the men ones. So these are my new friends. I'll put these line and take the strip off, and I'll put them in my underwear, and I can go about my day. I can go doctor's appointments, regular stuff, run around the yard, run around the house, and yeah. So these are my new things. You got to sleep with these too, brother. So. Because you don't want to have accidents at night, and you want to pee the bed like you were back at 2 years old, and nobody want to sleep with the kid, the cousin, to pee the bed, right? So that's what I'm up to. So I'm very happy now.
So how do you feel going from the catheter to this?
that cap. Oh gosh, that was something else. It was very traumatic. That was different. This is so much better than that.
Did you ever think you were going to get here? Because when you had the catheter in there, it's like you couldn't see past it.
Couldn't see past it. And it just sometimes it just felt like you wanted to regularly urinate, and I couldn't. So that was kind of traumatic. Then you still had to get up and dump the bag every night. So that was a little different. Every few hours, actually. Every time you drink something, you can really just see it go right into that. Different from you holding your bladder, and then you just like, you go when you want to go. Yeah, so it feels good. I feel like I'm making giant steps. I know I still have to wear these for a few more months, and that's without a question. So, you go back to work, you put them on, nobody knows. Now everybody know. I'll probably have them, but and there's you just go about your day and stuff like that. I realize I appreciate all the stuff women have gone through for years of have to wear and what they have to go through during their cycle and stuff like that, or just regular panty lines. I truly appreciate and understand now. So. Yeah, I'm just saying, I do. I understand. I'm in touch with my feminine side.
This extra little pad's good for the gray sweatpants.
Oh God, he give you brothers. He give you a little bulk, cause then you look like you out there. You hung and strong, but your boy already there. But it's fine.
Oh my God. So, yes. So talk a little bit about one of the things that you realized. This is getting really candid and really real and really raw, but this is what you said you were going to do.
Okay. This question is, go ahead.
Talking about it earlier. So you were saying when you use the bathroom, your stream is actually stronger.
Okay. Yeah. All right. So one thing I realized now reflecting on when I first started dealing with the prostate issues, is that one of the signs of the fact that your prostate having something like enlarged prostate or cancer, whatever, some issues, your stream when you urinate is not as strong. So I realized after I started from getting past the irritation sting from from healing from the catheter being pulled out, my bladder's starting to heal and the prostate's not there. The stream comes out strong. I'm urinating like I'm back I'm in my 20s again. So I noticed that already. So that's one thing you will notice. Well, in my experience, I don't want to say everybody's experience. I would just say be clear from my experience that it's coming back like a strong one. Yeah. So.
Mm-hmm. You getting it back together.
Getting it back together.
So. Yeah. Well, okay. It's been a few minutes. I think that's a good check-in for today.
Yeah. And the only thing I want to say to the brother, last thing I want to say, please go to the doctor.
Yes.
Do all the tests, get tested. Don't worry about people talking about, I want to finger my butt. That's only a moment. You remember, the first time they do it is all through blood and stuff like that. And when they do check, it's only a moment to see how hard, if your prostate is enlarged. That's all. So, but keep on getting checked. We got to work on start doing preventive stuff before it's a reaction. So I'm going to make sure, brothers, we start being more more preventative than reactive. So that's it. Peace, y'all. Love y'all.